Benjamin, maybe can you start by sharing a little bit more about Hutchinson Regional Medical Center?
Hutchinson Regional Medical Center is part of a broader system called Hutchinson Regional Healthcare System. It includes a 190-bed regional medical center, includes a non-for-profit hospice and home care company, a for-profit durable medical equipment company, a certified community behavioral health center, and a foundation, a $43 million foundation. And all of those really serve as a safety net healthcare delivery system for Central Kansans.
Yeah, and can you tell us a little bit more about Central Kansas? I know when we've talked in the past, you tell us about how it is right in the center of Kansas and represents a unique patient population.
We sometimes say that we are the middle of middle America. As a community, Reno County represents much of what middle America is and stands for. There's about 40, 50,000 people in our community of Hutchinson, a little bit more in the county, and we serve a regional population. But in this community, there's agriculture, so farming and ranching, there's manufacturing, there's a few manufacturing plants, there's a college with a national champion football team, a junior college. There's tourism. A world-renowned space museum is here. That is a sister to the Smithsonian. Apollo 13's capsule is there. There's an internationally known salt mine that's 600 feet underground, and there's a museum down there for the public to learn about that. There's a world-renowned golf course, 27th in the world golf course, and yet 3 or 4 miles away from that golf course, there is very intense poverty. And so there's significant socioeconomic disparities in this community. And really, there are two main zip codes in the community, and it's 67502 and 67501. And 67502 is where the golf course is located, and where much of the medical staff live. And 67501 is where everyone else lives, right? And that's overgeneralizing, but we sometimes note that we're a 67502 medical system trying to connect with a 67501 community. And 67501 is growing rhetorically. They're growing, and 67502 is remaining in that geographic area. So we're trying to figure out how to meet those needs and address health disparities in our community.
Yeah, thanks for breaking that down. Katie, can you share a little bit more about the parental leave policy you've adopted for your system?
Yeah. So July 1st of 2024 is when we officially launched paid parental leave. The goal behind this was to not only show our team members that we support them and the work that they do, but when we support their family, then it supports the community, and it kind of just has this overarching support system. Our generation is not having a whole lot of babies right now. I mean, there's a decline in the number of babies that are being born, not only in our community, but I think across the country. And so we needed to look to see
Hmm.
what can we do to support our team members. What things are the barriers? And so we've kind of adopted this phrase of "I would have another baby, but." And so, what can we do? How do our team members answer the end of that statement? And what can we do to help break down any of those walls? So, kind of the first thing that we did to launch this whole campaign was I would have another baby, but I can't take time off of work. And so, a lot of our team members are the breadwinners for their families, and they frankly can't take time off of work to have babies. And so, as an employer, we felt like that was the right thing to do. So we have 6 weeks of paid parental leave. This pays our team members at 100% of their pay for 6 weeks. And we offer it to up to two parents. So if both parents work at the healthcare system, then they both get the equal amount of pay. They can take it at the same time. They could take it one right after the other. One parent's leave doesn't subtract from the other parent's leave allowance or things like that. So they can both take the amount of leave that they need after the birth or adoption of a child.
That's awesome. And I think it's really important to sort of double down on the fact that it is available to both parents. it is something that can benefit the full family. You had mentioned in a past conversation, how often can employees take advantage of this policy?
Yeah, so we allow our team members one 6-week leave in a 12-month time period. And so we're seeing our team members on their second baby under this program. And so it's great to see it working not only on the first babies being born in the family, but maybe the second one now too. So it's neat just to see it unfolding.
Yeah, that's really
Yeah.
awesome. Benjamin, Katie touched a little bit on it, but can you talk about from your perspective what led to the creation of this policy and why is it so important for you as a health system to focus on family building?
I love that phrase, Priya, family building, because it's a backbone in the United States of our culture. And if we want to see this country thrive, we as employers need to be involved in that. So when I was at the Colorado Hospital Association, I led a statewide task force on the healthcare workforce. It was coming out of COVID, and we'd lost 20% of our workforce, and we're trying to figure out how to recover from that, believing it may take decades to really get back to where we were. And so we surveyed many of the hospitals in the state. And what came back was, and one of the things we learned was that before COVID, an employer taking interest in or investing in how employees get to work or who watches their kids or if they have enough food or if they can afford health care, if they can get into a house, investment in those areas, it was a best practice, gave them a competitive advantage in recruitment. After COVID, we can't find people if we don't take interest in where they live, who watches their kids, how they get to work, if they can eat, can they afford their health care. And so we very deliberately stepped into this space, just inquiring with our team members, what would it take to thrive? And because we're self-insured, because we're an independent health system, we've got some autonomy. I would sometimes say our autonomy is our superpower. It comes with it some risk, but we have the ability to be nimble and scrappy, and we can think through things. And when you have a system like that, and then you put a leader like Katie in a compensation and benefits lead role, who's willing to think radically about what we're doing here, we move mountains with that, especially with a supportive board. And so, I mean, our board's attitude, because we've got some money in reserves, is as long as we really have a very modest 1 to 3% profit margin, the board is satisfied during this season. And as long as we can do that, they're good with us getting more aggressive with employee benefits.
Yeah, that's great. And how have your team members responded to this, Katie? And from your perspective, what does success look like and what are you tracking from a metrics perspective?
This has been super well received by our team members. So since implementing this not quite a year and a half ago, we've been able to have not quite 40, so almost 40 team members take advantage of this leave. So it's been super successful. And like I said, now we have some team members who are planning their second leave under this program. So success can be a couple of different things. So, when you're looking at metrics, so our turnover rates have declined since implementing paid parental leave, and we've been doing some other things, as Ben alluded to, with our benefits and compensation packages. Our retention of our team members can't only be tied to this leave, but kind of the total rewards package as a whole, I would like to say. But I think in my opinion, what's going to be the driver that is what I determined to be, okay, this was a complete success, is when my kids and grandkids don't have to worry about making sure they have enough vacation time to take off as they grow their families, then that's success. When we have team members that might be looking at maybe going somewhere else to work, and they're expecting paid parental leave and they're expecting some of the things that we have just because we want it to be normal. This is normal. In our society, that most employers are going to offer you health benefits. And most employers are going to offer you PTO or vacation time. But right now, most employers don't offer a paid parental leave. So I want this to be what our society considers a normal thing to do. In my opinion, that success isn't going to happen overnight. But as long as we have employers who are willing to step up and be the trailblazers, then hopefully we'll kind of change that mindset in our society about making some of these things a lot more normal.
Yeah. No, and I think you're making great progress in that. 42 people in a year and a half being able to benefit from this policy is pretty significant. And I love to hear that some people are on the second round, right? So that is great news. Benjamin, what comes next? What do you do to build on this work as well as the question that Katie set forth at the beginning, which is, I would have another baby, but what are you looking at as you take that on in the future?
We just finished a survey in partnership with Dartmouth College. They surveyed about 400 or 500 of our lowest paid employees, bottom 25% of our wage earners. And how do they get to work if they ride share? Like there were a lot of questions related to it, but there was some incentive to complete the survey. And what will come next are focus groups that will happen in January, where we ask them, would you consider shuttles? Would you consider ride sharing? Would you consider an electric car if it were provided to you that would save on gas and provide more reliable transportation? We'll ask them a variety of questions, and then out of that, we'll seek grants or philanthropy to help solve it. So what we discovered in that survey was that there were really two neighborhoods in the city where the bulk of, when you looked at a heat map, where the bulk of these employees are coming from. And we're actually looking at partnering with an organization called Startup Hutch, which is an entrepreneurial network of folks, to start a transportation network where employees for a buck a trip out of auto deduct out of payroll, some nominal amount, can hop on a shuttle right that's picked them up right at their neighborhood or at a stop right near their house in a private shuttle system. So not necessarily waiting for the bus and the gnarly, around town many stops, but just getting them in a 10-minute trip from their house to work and back. We can accommodate the 6 or 7 to 7 shifts. That vendor can partner with other employers that maybe work 6 to 6 shifts at the prison or at a manufacturing plant, so that we could sustain that type of a transportation service. And then they would just be riding with their colleagues or coworkers to work and back. So we're looking to see would something like that work. But essentially, we want to make sure that a family that struggles to have a second car because there's two wage earners wouldn't actually need one, or maybe the single person that's living near a grocery store, or they wouldn't even have to have one car. They could make it to work and back with the shuttle system. And so we'll look at that. We're also building a new childcare center in partnership with the YMCA of Greater Wichita and the Cosmosphere Space Museum. It'll be a STEM-focused childcare center that will be available to both neurotypical kids and neurodivergent kids or kids with special needs. So we're about $2.5 or $3 million into the fundraising for an $8 million childcare center. We plan to break ground in the spring, and there will be an endowment associated with that, ensuring that every kid that's associated with one of our employees, so every one of our employees' kids could afford it. So it's being designed in such a way where astronauts play with kids. Like it really is it will lead the United States around innovation in early childhood development. So it'd be attractive to the doctor family who would move here for that, but accessible to the housekeeper, to the dietary worker, because it enriches everyone's experience when we have that kind of socioeconomic integration. And so that's what coming next is. We'll get to transportation, we'll address childcare, and all of those things, hopefully removing barriers to growing families. And we're also taking a look, we're not intentionally recruiting from certain populations, but we're seeing that we're tending to attract large families. We've recruited several physicians with large families. One has 10 kids, one has 6
Wow.
kids, and some are growing their family at that rate. One's on their way to their 4th kid. And we're attracting folks as we're setting this up. They're realizing, hey, we can come here and thrive. And so certainly we don't mind that either when they want to come do that. So a little bit of what's coming.
Yeah, well, all of that is wonderful. And I'm going to go a little bit off script to say, What advice would you give the healthcare leaders that are listening to this video that may be facing sort of an uphill battle to addressing these issues related to family building in their organizations? Are there any lessons you've learned or advice that you would offer to them as they start or move forward in this work?
Katie, what do you think?
I would love to answer that from my perspective. So for me, it's be willing to ask hard questions, be willing to challenge the status quo, and challenge the leaders of the organization. So from my perspective, there was an idea I had, and I said, hey, Ben, can we just let all of our team members who are on our health plan have services at our healthcare system for free? They don't pay anything other than the premiums. And he said, oh no, we can't afford that. So I took that back to the drawing board and we figured out how to afford it. So if I wasn't willing to challenge our leaders, then we wouldn't have some of the innovative things that we have today. And so I want people in my position to be willing to challenge the leaders, but then also the leaders in the organization be willing to be challenged. It takes a really good relationship between, the people in the organization to be comfortable with getting uncomfortable. So that would be my advice.
And Benjamin, how do you respond to that as the leader that's being pushed back or presented with new ideas?
I think she has to know I really care about the people who work here
Mhm.
and I want better for them, and that I'm stewarding the organization's financial resources coming out of a 10% EBITDA loss. Like,
Mhm.
if there's ever an organization that had an excuse not to get into this, it was this one 2 years
Mhm.
ago, because we just done a reduction in force, and it was very painful. Prior to my arrival here, they let go of 80 or 90 people, and massive losses, and we're still recovering, and we still are almost, but not yet, to break even, and are narrowly on our budget for this year by a few $100,000 on a $200 million health system, like just barely getting there. And so I also had to believe that Katie cared about the financial viability of the organization, that she wasn't going to continue to push things that would put in jeopardy people's jobs, right? Because
Mhm.
if we run out of, a reduction in force is a failure in management. I mean, it's we've allowed the health system to get to a point where we break the covenant we have with employees who just showed up and did exactly what they were asked to do, and then they lost their livelihood. And so I had to believe that she cared about that, and that we could really work together on this. And so when she brought stuff forward, she was really thinking through. She got with our CFO and figured out that, hey, because we're self-insured, if we just recapture a few percent in domestic claims of what's leaving the organization and keeping it, we can actually cover all of our out of pocket that way. We're uniquely in that situation because we provide these services internally. So once we looked at the numbers and figured it out, we thought, well, we've hacked it. We figured out how to do it. And that was on Katie for not just stopping with an idea, but going and getting with finance and figuring out how to make it work, and getting the buy-in of our CFO, who's, I think, particularly mission driven. And it has worked. And the healthcare expenses are up significantly. The utilization is up significantly, but we're paying ourselves, right? So it's from the right pocket to the left pocket, or vice versa. And so we're able to do that. And we're also now test driving this for what could this look like for a community health plan? And could other employers benefit from something like this if we're willing to share sort of the financial benefit of that, where we're not, looking to profit from them per se. We're just looking to make healthcare more affordable, but we're test driving it on our own team members and
Yeah.
figuring it out while the risk is lower.
Great. Thank you for sharing that. And is there anything else you'd like to share that we haven't covered yet about this work you're doing towards family building and what comes next?
We're tempted, I think, as healthcare leaders, to focus on profitability, and we have to, right? We have to make sure that we're of a viable system, and we're providing care to vulnerable people, and so many folks are affected by how we steward our resources. But I would challenge leaders to transition from, instead of simply how do I maximize market share or how do I maximize profit, acknowledging the necessity of a bottom line, that's black, not red, switching the question to what problem are we trying to solve? And how do we solve that problem? And then, well, what has to happen for that to happen? And what has to happen for that to happen? We go backwards. We start with the end in mind, with the problem we're trying to solve. And then we begin to hack it and innovate and get scrappy and figure it out. And so what we determined was every single employee here should be able to afford the services they're providing to other people. And that was not the case. So to use a rural Kansas phrase, that ain't right.
Mhm.
We just had to determine, okay, it's not okay that somebody in a PCT role who's working as a therapeutic worker or in the kitchen is providing services to other people that they can't access. So when we made these changes as proposed by Katie, for the first time in history, some of our employees were able to actually access the services they were providing to other people. In fact, one walked up to me and said, "It is so nice not to have to schedule a doctor's appointment the day after a payday."
Wow.
And that's how many of us live. That's how many people here live. And so now they don't have to worry about it. They schedule it when it works for their family. And so we're also thinking through, I think as we think about solving these things, we can get creative in ways that don't cost us anything. There's a dealership that has agreed to come over and pick up all of our employees' cars and bring them over for oil changes, service them, and then clean them out, vacuum and wash them for free
Wow.
at a 10% discount, and bring them back and then put the keys back in a holding place so that a team member can show up to work on their shift and come back and their car has been serviced and it was at a 10% discount. That didn't cost us any money. It's just an arrangement with a local business. I think that's considerate, and it takes into account that 80% of our workforce is women. They're moms that often get stuck doing that on a Saturday morning with their kids in the car, sitting in a business's waiting area. Well, if they get their car oil changed, that just eliminated it. They were able to get that done, but it was affordable and it was all while they were at work. So if we could think through solutions like that, I believe people stay. They want to be around that.
Yeah.
So
I love that. And it's not something I have ever seen in the work that I'm doing on women's health or with hospitals over the last 20 years, but that's such a simple and nice solution that makes life easier for women and families. So,
yeah,
Katie, anything that you'd like to add before we wrap up?
It's been an honor to kind of establish some of these things within our organization and really do the work to support our team members and their families in the community. So it's been an honor.
Yeah. Well, thank you both for the work that you're doing, and thank you for being willing to share it on video for this audience so that they have the opportunity to learn from it. I appreciate you and your time. Thank you very much.
Thank you.
thanks, Priya.